A 72-year-old man once sat in front of me and said, "Doctor, I've been doing this the old way for over 50 years, but recently my body has been reacting differently." He wasn't sick, taking new medications, or facing any serious health issues. Yet something was happening quietly in his body, and he didn't understand why. The truth is, what was causing harm wasn't self-stimulation itself, but the way he was doing it, just like many other men over 60. I am a urologist with over 12 years of experience working with older men, and what I see repeatedly is this. Many men continue habits they developed in their youth, while their bodies, hormones, nerves, and circulation have changed significantly after age 60. These seemingly harmless habits quietly affect the heart, prostate, blood flow, and even the ability to experience pleasure. The noteworthy point is that most men do not notice these changes. They think they are simply getting old, when in fact they are making small mistakes that their bodies can no longer handle as before. There are no obvious warning signs, but over time, these habits reduce energy, diminish sensitivity, lower performance, and affect overall health. In this video, I will outline 7 common mistakes that men over 60 often make during self-stimulation, explain why they cause silent harm, and show how to correct them to protect long-term health. This is not a video meant to judge or shame you. It is practical medical knowledge, designed to help you understand your body, care for yourself properly, and maintain health, confidence, and a sense of wholeness as you age. One common mistake I see frequently in men over 60 is relying on adult films as their main source of stimulation during self-stimulation. Many men come into my clinic looking embarrassed, occasionally admitting, "Doctor, I don't feel much anymore. My body even feels numb." They are not broken and have no underlying medical conditions. The real issue lies in the brain and the way they have received stimulation for many years, especially when this habit becomes excessive and continuous. The dopamine system in the brain, responsible for pleasure, motivation, and satisfaction, becomes less flexible with age. When you continuously receive intense, novel, and constant stimulation from adult films, the brain becomes overloaded. It has to adapt to high levels of stimulation, and over time, this system responds more slowly and becomes less sensitive to natural stimuli. This leads to a condition known as dopamine fatigue, causing the body and brain to no longer experience pleasure as they once did, both physically and emotionally. As a result, even when the body is still healthy, the actual sensation of touch, intimacy, or natural pleasure becomes muted. You may notice declining arousal, reduced sensitivity, and even a sense of distance and closeness with your partner. Many men mistakenly believe this is a sign of aging, but in reality, it is the consequence of the brain being overloaded with artificial stimulation. The good news is that this condition can be completely reversed. The first step is to pause or completely eliminate exposure to stimulating images from adult films for at least 2 weeks. During this time, focus on the body's natural sensations, touch, breathing, and presence in the moment. This allows the brain to reset the dopamine system, restoring sensitivity to natural stimuli, and gradually helps the body recover the feeling of genuine pleasure. Additionally, you can combine this with a mindfulness routine, paying attention to sensations, breathing, and bodily responses. By focusing on presence, you help the brain and nervous system regain signals for natural pleasure, improve blood circulation, and enhance sensitivity. This is not about returning to youth or increasing frequency, but about relearning how to enjoy sensations in a natural, safe, and science-based way. This first mistake quietly diminishes pleasure and the effectiveness of self-stimulation over time. But with proper awareness, patience, and mindful practice, you can fully restore sensitivity, enjoy natural pleasure, and improve overall health, from the prostate to the nervous system and mood. One mistake that many men over 60 don't realize is masturbating while sitting on the toilet. It may sound harmless, even convenient. A private space, a locked door, a few quiet minutes without interruptions. For many, the bathroom becomes the safest place to practice this habit. However, in reality, this position carries hidden risks that can quietly affect prostate health, pelvic circulation, and erectile function. When you lean forward while sitting on the toilet, the arteries and nerves in the pelvic area are compressed. After age 60, blood circulation is critical. Blood delivers nutrients to the prostate, supports erectile strength, and aids bladder function. When blood flow is restricted, these organs do not receive enough oxygen and nutrients, leading to tension, pelvic discomfort, and over time, problems such as urinary leakage or weak urine flow. I once had an older patient who continuously complained about groin tension, irregular urine flow, and discomfort after each self-stimulation session. When I asked about his habits, he admitted that most of the sessions took place on the toilet. This was the reason his sexual organs and prostate were under prolonged pressure, quietly causing damage that he hadn't even noticed. The solution isn't complicated, but it requires awareness. Instead of leaning forward while sitting, try standing, reclining, or sitting in a comfortable position that allows the pelvic area to relax and blood to circulate freely. This helps reduce pressure on the prostate, maintain healthy blood flow, and protect both bladder function and erectile strength. Even small changes in posture can make a significant difference for long-term health. Additionally, changing the environment helps the brain associate the self-stimulation experience in a more positive way. When the body is not compressed, it is easier to focus on sensations and breathing, enhancing the effectiveness of the habit. This is a way to combine science and mindfulness to maintain health, sensitivity, and sexual function without causing harm. Masturbating while sitting on the toilet may seem harmless, but it can quietly affect pelvic health, the prostate, and sexual function. Changing your position, allowing space for proper circulation, and focusing on natural sensations is a simple yet effective way to protect your health as you age. Another common mistake I often see in men over 60 is rushing through self-stimulation, treating it like a task that must be completed. Many men, especially those who were once busy with work and family responsibilities, tend to hurry. Just get it done so I don't waste time. But when you rush, speeding through the process, your body and brain receive the wrong signals. And over time, this quietly undermines both health and pleasure. When you speed up, your heart rate rises, blood vessels constrict, and muscles tense. The sympathetic nervous system, responsible for the alert state, is activated. This prevents the body from entering the deep relaxation needed for oxytocin, dopamine, and serotonin to be fully released. These hormones not only provide pleasure, but also act as natural healers, reducing stress, improving circulation, and boosting mood. When the pace is too fast, you may reach orgasm, but the body does not receive the full benefits. Instead of feeling refreshed and energized, you end up feeling empty, fatigued, and sometimes even more tense than before. Over time, this habit trains the brain to become accustomed to shallow, fast, and disconnected pleasure, reducing true sensitivity and desire. The real sensations from touch, breathing, and presence become muted. You may notice a gradual loss of interest in your own body and even in your partner. Many people mistakenly believe this is a sign of aging, but in reality, it is because the body and brain have adapted to an overly fast pace, losing the ability to fully enjoy natural pleasure. Correcting this mistake is simple, but requires patience. Slow down, breathe deeply, focus on each moment, and pay attention to your body's sensations and rhythm. Every movement has purpose. Every moment matters. As you reduce the pace, your body begins to receive relaxation signals. Hormones are fully released, and the brain gradually restores its ability to enjoy natural pleasure. No more rushing, no more tasks to complete, just genuine connection with your body and your own sensations. When the pace is adjusted, you not only enhance pleasure, but also improve circulation, support hormones, reduce stress, and protect prostate function. This is an important step in making self-stimulation a health-nourishing experience, rather than a rushed habit that quietly causes harm. One factor that most men over 60 fail to recognize is the important role of the pelvic floor. This group of muscles, located beneath the bladder, prostate, and sexual organs, plays a key role in maintaining urinary control, supporting erections, and sustaining sexual pleasure. When the pelvic floor is weak, all functions, from bladder control to sexual sensitivity, are affected. Yet because it is seldom discussed, many men completely overlook these muscles during self-stimulation, and the consequences quietly accumulate over time. I once had a 68-year-old patient, a former firefighter who maintained regular physical exercise and a healthy diet. Yet he wondered, "Doctor, I don't understand why my sexual function is gradually declining." When examining his habits and pelvic health, the cause became clear. His pelvic floor had weakened due to many years of sitting, stress, and lack of proper activation. Self-stimulation that ignores the pelvic floor or uses improper technique can further cause these muscles to atrophy, reducing circulation, bladder control, erection strength, and sensitivity. When the pelvic floor is weak, men may experience issues such as urinary leakage, urgency, weak urine flow, and slight loss of control after ejaculation. At the same time, sexual function declines and the sensation of pleasure becomes shallow and incomplete. The danger is that this process happens quietly, and many men only notice it once the symptoms become pronounced and begin to affect quality of life. The solution is to activate the pelvic floor properly during self-stimulation. A simple method is to contract the muscles you normally use to stop the flow of urine midstream, hold for a few seconds, and then release. Repeat this rhythmically during stimulation, combined with deep breathing and focus on sensations. This helps exercise the pelvic floor, improve circulation, and stimulate the pelvic nerves. Just a few minutes each day can make a significant difference in bladder control, erection strength, and sensitivity. Reconnecting with the pelvic floor not only helps restore physical function, but also enhances confidence and a sense of presence in the body. When these muscles are strong, you not only gain better control over physiological functions, but also maintain energy, pleasure, and the ability to fully enjoy self-stimulation. This is one of the most important steps that most men over 60 often overlook, yet it provides long-lasting benefits when done correctly. One issue that many men over 60 often face but is rarely discussed is an inappropriate frequency of self-stimulation. Some worry that they are doing too much, while others feel they have gone too long without it, unsure if it matters. Both extremes, too much or too little, can quietly cause harm, affecting prostate health, blood circulation, hormones, and even the experience of pleasure. When you engage in self-stimulation too frequently, the body can become overloaded. The prostate may be continuously stimulated, the pelvic floor fatigued, circulation reduced, and hormones no longer perfectly balanced. Pleasure becomes mechanical and shallow, and what should be a relaxing, restorative experience turns into a task that depletes energy. Conversely, if too much time passes without practice, the organs in the pelvic area, prostate, and related nerves become stagnant, blood flow decreases, sexual function declines, and sensitivity gradually diminishes over time. I once had a 72-year-old patient who had consistently maintained a self-stimulation routine, but recently stopped completely due to being busy and thinking, "I'm old now, it doesn't matter anymore." He began experiencing weak erections, slow urine flow, and dulled pleasure. Conversely, men who maintain the habit too frequently complain of fatigue, pelvic tension, and difficulty achieving satisfaction. Both cases demonstrate that an excessively high or low frequency can negatively affect the body. The solution is to find a balanced rhythm that suits each individual's health and body. For most men over 60, 1 to 2 times per week is ideal when practiced mindfully, with focus and attention to sensations. The goal is not about right or wrong frequency, but maintaining a rhythm that keeps the prostate healthy, circulation steady, the pelvic floor functioning well, and hormones balanced. This is how self-stimulation can preserve pleasure while protecting long-term health. Overall, paying attention to frequency not only protects physical health, but also helps maintain sensitivity, energy, and enjoyment when connecting with your body. By listening to your body and understanding the rhythm that works best, self-stimulation becomes a health-enhancing practice, rather than a habit that quietly causes harm. One common mistake I see in many men over 60 is using excessive force during self-stimulation. As sensitivity decreases with age, the instinct is often to grip tighter, squeeze harder, or use rougher surfaces to feel pleasure. But this backfires, quietly causing damage to the body. The nerves in the penis are extremely sensitive. Prolonged excessive force can create small tears, scarring, reduced elasticity, and even penile curvature, Peyronie's disease. These changes do not happen immediately, but accumulate over many years. I once had an older patient, 70 years old, who complained that his sensations had significantly decreased compared to before. When reviewing his habits, he admitted that he often used more force to feel pleasure again. His case is not uncommon. Many men believe that the harder they go, the more pleasure they will feel, but in reality, this pressure damages the nerves, reduces circulation, and makes recovery more difficult. Additionally, it affects the brain. Pleasure becomes a struggle rather than a relaxing experience, which decreases oxytocin, dopamine, and serotonin, the key hormones that reduce stress, increase arousal, and improve mood. The long-term consequences of this habit are not only reduced sensitivity, but also structural changes in penile tissue, decreased elasticity, pain during stimulation, and pleasure becoming shallow, brief, and incomplete. At the same time, the body loses its natural recovery efficiency, pelvic circulation decreases, hormones become unbalanced, and the experience of pleasure no longer feels relaxing or restorative. Correcting this mistake is fairly simple, but requires patience and awareness. Be gentler, slower, and focus on sensations rather than pressure. Each session should be a mindful experience, connecting with your body, breath, and natural rhythm. Reducing force helps maintain healthy circulation, protect nerves and soft tissue, and allows the brain to receive sufficient hormonal signals for full pleasure and relaxation. With consistent practice, you will notice natural pleasure returning, sensitivity restoring, and your body being protected for the long term. In summary, using excessive force not only destroys pleasure, but also quietly diminishes sexual function and long-term health. Changing your approach, being gentle and attentive to your body, is a crucial step to make self-stimulation a health-nurturing experience rather than a habit that silently causes harm. The final mistake I want to highlight, and perhaps the most profound, is not directly related to the body but to the mind and emotions. Many men over 60, after years of self-stimulation, gradually become mechanical in this habit. They no longer truly connect with their bodies, focus on sensations, or experience the moment. Instead, self-stimulation becomes a mechanical action, done out of routine or simply to relieve stress, boredom, or loneliness. When self-stimulation loses its emotional connection, it also loses its restorative power and the deeper benefits it provides to both body and mind. I once had a 71-year-old patient who complained that, even though he was self-stimulating regularly, the pleasure was no longer the same. He said, "I don't feel anything special anymore. It's like I'm just going through the motions." This is not an age-related issue, but a loss of connection. When pleasure becomes mechanical, the brain stops releasing oxytocin, the bonding and stress-relieving hormone, dopamine, the hormone driving pleasure and motivation, and serotonin, the mood-stabilizing hormone. The result is that you may reach orgasm, but the experience feels empty, not relaxing, unsatisfying, and can even leave you more fatigued than before. A lack of emotional connection also robs self-stimulation of its spiritual value. You no longer feel presence, gratitude, or joy from your own body. This habit puts both mind and body into a passive state, disrupting natural recovery and affecting long-term sensitivity. Pleasure becomes shallow, the body receives insufficient circulatory and hormonal signals, and the experience is no longer a mental reset but a monotonous action. Correcting this mistake requires mindfulness and attention. Approach self-stimulation as a complete experience. Focus on your breath, sensations, body rhythm, and presence in the moment. Turn this action into a way to connect with your body, enhance sensitivity, and enjoy natural pleasure. Treat each session as an opportunity to reconnect with your body, nurture relaxation, boost positive hormones, and restore mental well-being. By bringing emotion, awareness, and presence back, both body and mind are revitalized, and self-stimulation becomes a full, deep, and health-enhancing experience. After learning about the 7 common mistakes in self-stimulation for men over 60, the important next step is knowing how to apply this knowledge to improve both health and experience. Each mistake not only affects the body, but also impacts the brain, hormones, circulation, and the perception of pleasure. Understanding these factors helps you change habits in a scientific, safe, and effective way. First, reduce or eliminate relying on adult films as the main source of stimulation. Focus instead on the body's natural sensations, your breath and presence in the moment. Give your brain a chance to reset the dopamine system, restore sensitivity, and recover the ability to fully enjoy real pleasure. This is the first step toward making self-stimulation a complete and fulfilling experience again. Next, change the position in which you perform self-stimulation. Avoid leaning forward for long periods on the toilet, as this compresses the blood vessels and nerves in the pelvic area, causing tension, discomfort, and affecting the prostate. Try standing, reclining, or sitting in a comfortable position to improve pelvic circulation, helping maintain sexual function and blood flow. The third important point is to slow down and focus on the experience. When the pace is too fast, relaxation hormones are not fully released, pleasure becomes shallow, and the body feels fatigued. Instead of rushing, practice deep breathing, pay attention to bodily sensations, and enjoy each moment so that the brain and nervous system receive the full signals of natural pleasure. Don't forget to activate the pelvic floor. Gentle contractions during self-stimulation help improve circulation, enhance bladder control, maintain erectile strength, and preserve sensitivity. Practicing this regularly for a few minutes each day can make a significant difference. Next, maintain a reasonable frequency, 1 to 2 times per week. Practice with awareness and attention, enough to sustain blood flow, balance hormones, and preserve sensitivity, while avoiding too little or too much, which can have negative effects. Finally, perform self-stimulation gently and with emotional connection. Avoid excessive force. Focus on sensations, breathing, and mindfulness. Bringing emotion and awareness into the process helps restore sensitivity, hormones, circulation, and enhances psychological benefits. When done correctly, the body is nourished, pleasure becomes deeper, and overall health improves. By combining all these steps, you can scientifically reconnect with your body, protect the prostate, increase sensitivity, improve sleep, sharpen the mind, and support long-term health. Self-stimulation is not just a personal habit, it is an essential part of maintaining health and dignity as you age. Age does not mean giving up your body, your joy, or your autonomy. The 7 mistakes we just explored are not your fault. They are habits accumulated over time, quietly affecting the prostate, pelvic floor, circulation, hormones, and pleasure. When you recognize and adjust these habits, your body begins to recover, sensitivity returns, and you feel a fuller connection with yourself. Each step, reducing reliance on adult films, changing position, slowing down, activating the pelvic floor, maintaining a proper frequency, using gentle force, and bringing emotion into the experience, provides profound health benefits. When practiced consistently, you will notice improved circulation, balanced hormones, deeper sleep, stable mood, and increased confidence and control over your body in daily life. These small steps are not just techniques, they are ways to reconnect with your body, listen to yourself, and take care of yourself. Aging is not a limitation, but an opportunity to live healthy, clear-minded, and fully. Start today, and you will feel the difference in every breath, every moment of relaxation, and every sensation in your body. If you found this video helpful, please like, share, and subscribe so you don't miss future content. Leave a comment sharing where you are watching from and which habits you want to improve so the community can learn and support each other. Your body still has vitality and value. With the right care, sensitivity, pleasure, and overall health can return.